Welcome, everyone, to the Vitamin D and Me podcast. We're delighted today to be joined by Dr. Grace McComsey, MD, Vice President, Research and Associate Chief Scientific Officer at the University Hospitals Health System in Cleveland, Ohio, as well as an Associate Principal Investigator at Case Western Reserve University. So, Dr. McComsey, thank you so much for spending some time with us today.
Thank you, Bill. My pleasure. Thanks for having me.
And you've done a lot of interesting work in a lot of interesting areas, find very fascinating. So if you could perhaps talk to us a bit, explain about yourself, what you do, some of the research you've done, and then we'll get into it from there.
Sure. I'm a physician by training. I did infectious disease for both adults and pediatrics. So I got into working on HIV. It's a very fascinating disease that changed a lot because of research. So I think that really fueled my passion for research. I believe, we can make tons of advances like we did in HIV in a very short time if we can convince people that research is important and they should volunteer for research. So I did a lot of work on HIV, and then obviously now with COVID, I had to pivot to try to help answer a lot of questions about COVID. So I've been doing a lot of work on COVID as well. And I think one thing about myself that's probably a little different than other physicians is I do believe that nutrition and lifestyle factors are really important in keeping people healthy. So it's not just about drugs and devices. I do a lot of work on vitamins, on supplements, and my goal is to prove whether they work or not, but prove it in a well-done research study. So I feel like that's really one area I'm very passionate about.
And just out of curiosity, I know I pick up the Eastern European accent a little bit. Is that correct?
No, I'm from Lebanon.
From Lebanon, okay.
Yeah, because I studied in a French medical school, so my accent is not typical Lebanese.
Okay, yeah, it sounds a little Eastern European or Slavic. The reason why I bring that up is I'm Eastern European background, and I find that area of the world and that culture, German, Polish, Austria and Switzerland, they're very much more focused in the way you are. So I wondered if that, with the integration of holistic medicine, it's not simply jump right to full-scale pharmaceutical. It's a nice mix of trying some other types of therapies and interventions first before you simply go right to a fully pharmaceutical regimen for a patient.
Correct. And in Lebanon, actually, and Europe, I think they're even, better than us in terms of considering, lifestyle. I mean, they walk everywhere. We try to find a parking slot, right next to the entrance. I mean, this is how we are here. And, unfortunately, I took on some bad practices also here, but I still care a lot about living a healthy lifestyle. I think it pays off, later in life. It's easy when you're in your 20s to say, I don't care, right? You're going to be healthy anyway. But when you start aging prematurely and you start having, inflammation and pains and muscle aches, it really, goes back to preventing early aging and preventing being susceptible to a lot of bad infections like COVID now. I mean, that's a good example of how you can protect yourself in a way by being healthier before something like COVID hit or another pandemic that's probably, will come. Maybe in our lifetime also we'll have something else happen.
Sure. And what got you going in vitamin D as being a practicing physician with all the tools that are available? How did you begin to get interested and fascinated with vitamin D as part of your treatment regimen?
Yeah, so vitamin D fascinated me a long time ago. About 8 years ago, I received a 5-year large grant from NIH, National Institute of Health, to study vitamin D in HIV patients. because I had done some smaller studies that showed that vitamin D levels were not only important in people with HIV in terms of bone, which we all think about, right? So bad vitamin D or poor vitamin D status is a predisposing factor to osteoporosis. And that was the case in HIV, but I did studies linking poor vitamin D status to higher cardiovascular risk. So whether doing carotid IMT or looking by CT scan, there was a link after adjusting for everything else between having a poor vitamin D status and higher risk of cardiovascular disease. So it got me interested in that area. And HIV is a fascinating example of a disease where people are taking one pill now, one pill a day only. They live almost a normal lifestyle, but they have high inflammation in their system. And this is one problem that remains in people with HIV. So they're young, they're doing well, but they have high inflammation, higher risk of cardiovascular disease, higher risk of osteoporosis. So all the phenotypes that are related to having high inflammation happen in HIV. So it's a good example of a disease with high inflammation, like lupus, like rheumatoid arthritis. I mean, the research you do in one area like HIV is very applicable to other areas with high inflammation. So I started working on vitamin D in HIV, and that's fueled my interest in that research.
And how does vitamin D assist with risk reduction and working with an inflammatory response to assist one's own health? How does that work?
Yes, so we showed that, for example, in HIV, in that NIH study, we showed that even young people who are what we call virologically suppressed. So basically, they're taking HIV pills. You can't even find HIV in their blood. Their level is so low in the blood. So they're under very good virologic control. What we found was that when they took vitamin D supplementation, it affected within 48 weeks or a year, basically, it decreased their inflammation and it decreased their immune system being activated. So what happened, with HIV and other diseases, you activate some cells in the immune system. So they start producing what we call cytokines. It's some substances in the blood that cause all the badness, from cancer to bone problems, to heart disease. So HIV is that example of a lot of cytokines, lots of inflammation in the blood. So vitamin D supplementation with nothing else other than vitamin D supplementation done in a controlled manner. So we had a control arm and we had different doses of vitamin D. And what we found was even a medium dose, you don't have to take a very high dose, was associated with improvement, not just in bone disease, but in inflammation and immune activation. So it was fascinating that, all you had to do is to take vitamin D to see that effect. None of the big shot drugs that you take with a lot of side effects, just vitamin D.
I like that phrase you had, immune activation. Can you define that a little bit further for us? What does that mean? Sounds very intriguing.
Yeah, so the immune system is funny, actually, because some cells in the immune system, you hear about T cells and B cells, right? They're different form of white blood cells that help in fighting infection. So they are important. The B cells produce antibodies. Everybody knows those terms now from COVID, right? All you hear is you have antibody. So the B cells are important to recognize that, oh yeah, I know that virus, right? Like COVID, and they produce antibody to fight it. And then T cells work a little different way, but also they help in fighting an infection. And we learned from COVID, both of these are important to protect you against severe COVID and against COVID itself, like being susceptible to it. So what happened in some diseases like HIV is you want them to work, but they're overworking. So they're hyperactivated. And by doing that, they're producing always inflammatory cytokines in the blood. So you have all these substances that are, lead to problems, heart disease, bone, that are continuously going into the circulation. And it's because the cells are working more than they're supposed to. It's like they need to be attenuated in a little bit. Now, you tell somebody that the problem in HIV is the immune system is hyperactivated, and they go, wait, but HIV depresses the immune system. So it's funny, you don't want it to be suppressed by the HIV virus, but you don't want it to be overactivated, because then you have a lot of inflammation. So by providing vitamin D, we were able to kind of suppress the inflammation to lower levels. Not bad, because you still, it's still a little higher than the normal population, but at least it suppressed it enough in a very short time, in 1 year. So that was good results, actually. I mean, we had a lot of positive, several papers that came out of that. So now in HIV, myself, a lot of physicians really pay attention to vitamin D to ensure that the vitamin D level is in a good range. At least, it's above 30, which is like what we call optimal or sufficient range.
Yeah. You referenced earlier poor levels or poor results in individuals' vitamin D levels. So just to unpack that a bit further, you mentioned one of your cut points there for what you consider healthy or normal or appropriate. Take us through a little bit further what you see in blood results in terms of levels, and what you say as a practicing physician, okay, this person needs to get on D, or this person's in a good range. What are some of your thoughts on that?
Yeah, so I mean, you probably know that if you talk to endocrinologists, right, they consider themselves vitamin D expert more than other physicians. There's a big fight on what is the optimal vitamin D level. Now, we all know that less than 20 is bad for bone. So 20 is considered, a differentiating between vitamin D being really bad. Like everybody agrees, less than 20 is bad. But
that's think super deficiency. Deficiency.
Exactly. Yeah. Between 20 and 30, most people call it insufficient, meaning it's not very bad, but we would like it to be at least 30. We would like it to be sufficient or optimal. That will be above 30. But the reason I mentioned that endocrinologists, disagree is there are a lot of people who are pushing for 55 to 60 to be the good range for vitamin D, because there are some studies that show that to prevent cancers, if you're in that high range. I'm not convinced yet that we're there, but I think, down the road, we may get to a point that we say 30 is not good enough. We really should push it to higher than that. Now, one thing I was gonna say, I did a study in HIV that will be actually presented at the American Heart Association meeting. So what we found was vitamin D, despite my love for it and everything, we found a little problem in HIV. Vitamin D levels were associated with having more vessel calcification. So, in the heart, there are coronary vessels, right? So we found that calcification of these vessels, which is a risk factor for heart disease, was associated with high vitamin D levels. So on one hand, you say, wait, I thought it was good. It is good for inflammation, but we have to make sure that we don't overdo it with vitamin D to a degree that we have extra calcium in the circulation. Because when you have extra calcium, guess where it goes? To areas that you don't want it to go, including the vessels, right? So we have to be careful by using vitamin D by itself, because if you go to a range where there's a lot of calcium in the circulation, unfortunately, some of it will deposit in the heart vessels and create a risk for heart disease. So we have to be careful with vitamin D. And this is why research is important. We can't just say, this is good, so take as much as you want. There is a certain level that it may be bad.
And what on the vitamin D higher dosing levels, what is sort of the general discussion or some of the general themes around what is considered too much or overdoing it? If you're not attenuating, if you're taking it as a standalone, what is too much?
Yeah.
In the discussion right now.
We're not. That's why some people are careful to say take too much. So they stick with the 30 level because they're worried that if you are above 30, that maybe some of that extra calcium will go in the wrong places and do more harm than good. So that's why now the recommendations are 30. The people pushing for higher, they're looking at the cancer prevention. They're looking at other things that may be beneficial with vitamin D being high, but we're not there yet. So now what I tell my patients is stick with level 30. So take enough vitamin D to get you to 30. Or there's another vitamin K2, that if given with vitamin D will prevent all the trouble with the vessel calcification. So vitamin K2, if you give it with D, it will take that extra calcium that's in the circulation and put it where it's supposed to be, which is in the bones. So it kind of funnels it away from the vessels, from the bad areas, and put it exactly where you want it to be, which is in the bone. So one solution to the vitamin D, not being worried about taking too much, is to take the vitamin D with the vitamin K2, because that really protects against the extra calcium going to places you don't want it to go.
Understood. Yeah. And what are some of the dosing levels, so to speak, or some of the recommendations? I know it's all patient specific, but when you look at, if someone presents to you as a doctor and that you get their blood work done and their vitamin D is insufficient, you want to raise their levels to get them to that 30 mark and maybe a little beyond. And they say, well, doctor, I've really read everything online and I'd like to really ramp up my D levels. And you say, okay, well, then you should take K2 alongside it. What is kind of the general rule of thumbs that you see in your practice, knowing that it's patient specific, when you're saying take D and K2 together?
So when I give D, it depends how bad they are, right? If they start with vitamin D of 5, for example, I'm going to be more aggressive and give them the 50,000 once a week to be able to get them higher quickly. If the vitamin D is only 18, I'm going to use, maybe 2,000 a day if it's by itself. If I'm giving it with vitamin K2, it's easier for me because I don't have to worry about the hypercalcemia and I don't have to worry about the vessel calcification. So then if I combine the two, I can give up to 5,000 vitamin D a day, and I don't have to worry that 5,000 a day is going to cause harm, vessel calcification being one. So I give K2 and D, and that's what I take, actually. I take 5,000 vitamin D a day, along with K2, 180 every day. And I think the more research I do on this combination, the more I'm convinced, why not? I mean, the safety is excellent. In fact, vitamin K2, to date, there is no safety concerns with it. So you can really I take 180, you can take up to 180 and not worry about side effect. And it helps to prevent the side effects of vitamin D, taking too much vitamin D. So you get the both good things from the vitamins together.
So they both have a solid safety profile and work together synergistically.
Absolutely.
In the right balance. Very interesting. And where does K2 come from? Because a lot of people are familiar with D, but not as familiar with K2. It's been around for a long time in research and nutritional sciences, of course, but it still is a fairly new ingredient on the scene in sort of, I'd say, the public consciousness when you compare it to like a D or a vitamin C as an example. So tell us a little more about K2.
It's sad to say it's not just the public. I can tell you, like my colleagues, physicians, nurses, you ask about K2, they go, wait, what is K2? Like I know vitamin K, but what is K2? So
Yeah.
it is
Isn't that a mountain in Japan or something like that?
Yeah.
Right?
Well,
Yeah.
it is, yeah. So there is a food, natto has a lot of vitamin K2. So other areas like ninjas and, in Japan, they eat a lot of it. So they have very good vitamin K2 status. But here in the
Okay.
US, our food is really awful in terms of vitamin K2. And in fact, you need to eat ridiculous amount of eggs, for example, every day. I think I did the calculation. You need like 7 whole eggs every day to be able to get quarter of your daily requirement of vitamin K2. So
Wow.
our food in the US is awful in K2. So that's why we need supplements. That's why I take a supplement, because I don't want to eat that much eggs, yolk, and end up with heart issues, right? High cholesterol. So I take the K2 as a supplement. So K2 is part of vitamin K. I would say this is something all of Europe is way more aware of than the US. In fact, you talk to European physicians and they go, oh yeah, K2, I take that. American physician, I have not heard, before I wrote the book on K2 and D, I did not hear of any physician at my hospital, and trust me, we have thousands of physicians, who was taking K2. Now, after I wrote the book and after I did research on K2 and COVID as well as HIV, now a lot of physicians here ask me, what should I take? How much should I take? So it's becoming actually more and more something that people are talking about. And the best thing you can do is to do research on it, because when at the American Heart Association meeting, we're going to present our data on K2, D, and the whole calcium in the vessels. I'm sure it will be talked about because it's a huge meeting, tens of thousands of
that's a big meeting.
Yeah, exactly. So that's the way to do it. You do research to try to disseminate the findings and convince physicians that it's really important to take K2 along with the D.
Yeah, very, very intriguing. And then when it comes to COVID as it relates to vitamin D and vitamin K2, is it a similar situation in terms of sort of building the immune health, the immune response, the immune engagement? Tell us a little bit about that with your COVID patient experience. I think that'd be very interesting.
Yeah, so we have a paper that's now is published. So we have published peer-reviewed data, unlike a lot of COVID studies that were they just put them in the media without any peer review process. So we have a published paper that describe our findings with both vitamin D levels as well as K2 levels and COVID. So what we did is we enrolled 100 patients with acute COVID infection. Some were hospitalized in the hospital, like really sick. Some ended up dead, unfortunately. And some were outpatient, so they had mild disease. So we had all kind of range of diseases. We checked vitamin D on them as well as a marker of vitamin K2 status. And what we found actually were very intriguing, and that's what we published, is that despite all the known risk factors for COVID, for having severe COVID, like older age, high BMI, remember obese people really have a hard time with COVID and they end up, with more severe disease. So when we adjusted for all the comorbidities, BMI, for race, for sex, all the factors that have been associated with severe disease, the most important factor ended up poor vitamin K2 status. So people who had poor vitamin K2 had way higher chance to end up either dead or on a breathing machine, mechanical ventilation. And vitamin D, it was similar effect. It was little lesser in intensity than with vitamin K, but both of them had the same positive effect. And I'm sure you heard about vitamin D, all the studies with vitamin D
Yes.
showing kind of same thing, that when you take people who are hospitalized, I mean, our study was good in the fact that we had all kind of intensity of disease. So some people had very mild. In fact, we had even 4 people who had asymptomatic. They were exposed to it. They tested positive, but they had no symptoms. So we were able to study the range of manifestations of COVID. Other studies studied only people who were hospitalized with COVID and found that vitamin D level at baseline predicted also severity of the illness, whether people died or not. So ours looked at both D and K together. As I said, found that both independently predicted the course of COVID. And that's why, we published that and it was accepted, because that's really neat if you could kind of prepare for COVID. I'm not saying don't take vaccination. We know it's very important. I was one of the first who got vaccinated in Cleveland because we have to end the pandemic. But at the same time, nobody says that you shouldn't do your best with other things like lifestyle, like taking vitamins to be prepared for COVID. So people ask me, like, should I delay my vaccination to take K2? I'm like, absolutely not. You do both in parallel. You get vaccinated, but you get ready. It helps probably with other respiratory infections as well, right? Like flu.
Sure.
So I think, the right thing to do is be healthy, be ready for the next pandemic.
Yeah, no, great advice and great information. Dr. McComsey, I want to thank you so much for your time today. Really interesting discussion, and really appreciate you joining us on the Vitamin D and Me podcast.
You're welcome. Thanks for having me.